Okay, folks. So one of the common complaints I hear in the clinic is people coming in with hip pain, back pain, SI joint pain, sciatic pain, uh, you know, any kind of pain in the pelvic area. All right. So I want to show you a common problem that is typically occurring. It's called anterior femoral glide syndrome, and what it means is that the thigh bone is sliding around in the hip socket too much. So the thigh bone should just be pivoting like this model, all right? But in these people with chronic hip pain, SI joint pain, and so forth, the thigh bone, they've developed something called anterior femoral glide syndrome where, while the thigh bone is pivoting like this, it's also sliding forward. Anterior means forward, all right? So why is this happening? Well, it's because of poor butt control of the femur. So the butt starts here at the sacrum, all right? And it attaches in here to the top of the thigh bone. And if it's working properly, it will contract at the right time to create a pivot point for that hip joint, okay? So if you're having chronic, whether the pain is in the front, the side, or the back of your hip, or all over the place, in my experience, often this is due to an anterior femoral glide syndrome, and then strengthening this correctly, and then changing the walking, sitting, standing habits that are causing gluteal dysfunction are the key to solving this. All right, we're very successful at solving these kinds of things at the clinic. So anyway, I hope that clears things up about what is anterior femoral glide syndrome. As you can imagine, if it's gliding forward, it's going to pinch tissues in the front, can cause labral tears and so forth, irritate other things. If it's gliding forward, it's going to cause a bursitis in the side. And if it's gliding forward, it's going to cause a piriformis-like pain or SI joint pain in the back, or it'll be diagnosed as global hip arthritis because all of that hip careening around in there is causing an inflammation in the hip joint. So I hope that helps. It's a lot of information in a short video, but hopefully that gives you some more hope for solving your hip issues.